Our thoughts are certainly with them. Now, losing a loved one is hard enough, but losing them under questionable medical care would be unbearable. Yet it's a terrible predicament Adelaide widow Anne Gratchinen is in. Since her husband's death 6 years ago, she's discovered his doctor rorted Medicare, that his specialist supplied misleading notes and that the hospitals failed in their care. But as Graham Archer reports, our health complaints body has so far refused to investigate.
Tom was just too wonderful to be trashed like he was, and so is everybody else. Nobody should have to be treated in this appalling manner, and I will keep going until it does change.
When Anne Gratchinen's husband Tom was gravely ill, she knew his treatment was not right.
The notes bear this out. They show quite clearly that there was no monitoring and no careful adjusting of anything.
The grief that followed his death was overwhelming, but her subsequent struggle for answers has added immeasurably to her suffering.
It's been absolutely horrendous, the most harrowing part of my life. 4 years really of just unrelenting emotional, almost psychological damage. It's the only word I can use for it.
Despite the obstacles in her way, her persistence has exposed a catalogue of systemic failures and a Health Complaints Commission that is itself the subject of an alarming number of complaints.
That makes you the fourth most complained about agency in the state.
I don't know about that.
That's fourth behind WorkCover, Public Trustee and the courts. They're the big three. Then your commission.
Okay, and what I would say to you is that of itself isn't a problem for me.
Anne always believed her husband's fragile health had deteriorated further following 2 flu and pneumonia vaccinations in the same arm administered by his GP. So her inquiries began with him.
I asked him not to do the double vaccinations to anyone ever again.
And what was his response?
He straight away said, OK, I won't. He didn't even have to think about it.
However, she persisted.
I said to him that that was good, but it wasn't enough, that he needed to make sure that his colleagues don't do it either.
And what reaction did you get from him?
His response was to start shouting, and he threatened to get his lawyers onto me.
The vehemence of his reaction stunned her. It was years later she discovered why he was so agitated.
So I asked Medicare for the records, and I found out that the GP had in fact billed them for 2 separate appointments, where in fact he'd only had the 1 appointment and given the double injection in that one.
He was double dipping?
Yep.
I mean, that's effectively Medicare fraud, isn't it?
Yes. He defrauded the system, and he was out of line in terms of professional conduct too.
The GP, who resigned shortly after her visit, refused to provide any further help.
So I thought the only way that I'm going to know the truth is I have to get the notes and go through them myself. So I did that, and I found that...
But that wasn't easy either, getting the notes.
No.
Anne approached the Repat Hospital and Flinders Medical Centre, where her husband had been treated and where she believes his heart condition had worsened because he'd been allowed to seriously dehydrate.
They couldn't find the notes themselves. 2 months it took, in what was supposed to have been a 14-day turnaround.
When she finally got them, they were incomplete and in places misleading, but contained enough to support her suspicions.
Yes, definitely backs up. Errors were made, and there are other times there where doctors have made, great pronouncements and assertions, and the notes clearly say this didn't happen.
Anne also contacted her local MP, setting off a chain of letters from Minister Hill's office to the regional office, from there to the hospital, and then back to the regional office, then to the Minister, and finally back to Anne.
I didn't know that they were changing along the way until I did a Freedom of Information at the end of it, because I was so outraged that the last letter, where I'd sent in masses of proof, irrefutable proof, and all that came back through the Minister was a 2-paragraph denial. And I thought, nah, this can't be for real.
Nor did the original letter, as required by law, inform her that she could seek assistance from the state's health watchdog, the Health and Community Services Complaints Commission.
So that's a mandatory inclusion?
Yes, it's a mandatory requirement.
And it was omitted from the Minister's letter?
It was more than omitted, it was actually edited from it.
When she finally learnt of its existence, her complaint was rejected on the grounds it exceeded their 2-year time limit.
The Health Complaints Commission said, this has all taken too long, you're out of time.
Yes.
And blamed you for that?
Yes.
Effectively?
Yeah, but then the only advice was, we're not going to do anything. You need to take legal action, which will be painstakingly expensive and very difficult.
Parliament's put that 2-year rule in there for a reason.
Lena Sedano is the Commissioner and acknowledges she has the power to ignore the rule if she chooses.
You've got significant powers to investigate.
Yes, I do.
You can, using the court subpoena documents and records, you can make people give evidence under oath.
That's right.
And yet, in that same 4-year period, you've conducted just 6 investigations.
It's a bit more than that now, but yes, that'd be about right.
That's from over 4,500 complaints. And in the same 4-year period, just 1 recorded conciliation.
Look at the statistics and you kind of think, well, are you guys sitting on your hands?
Well, I can assure you we're not sitting on our hands.
Well, you know, those statistics speak for themselves.
Last year, Family First's Robert Brokenshire moved that there be a standing committee established to investigate the poor performance of the Complaints Commission.
Bearing in mind now that this has been up for 5 years approximately, and millions of dollars of taxpayers' money has been invested into that office, and frankly, not only myself but many of my colleagues expressed concern about whether we're getting, you know, good value for that taxpayer investment. And if we're not, who's responsible?
All I can say is I know that we're not perfect.
That now seems obvious to everyone following an independent review just tabled in Parliament.
Even the government has criticised them for the low number of complaints they've handled, the cost of those complaints, the fact that they've got no clear definition of success, and yet the Commissioner wants a bigger budget. It's a bit of a schmozzle, isn't it?
Frankly, it does seem very much like a schmozzle, and that's what concerns me as a Member of Parliament.
In the meantime, Anne contacted one of her husband's specialists, and in a meeting she was permitted to record, he conceded her concerns about Tom's dehydration were well-founded.
Lots of ifs and buts.
Well, I couldn't agree more.
I guess what disturbs me is, you know, that he was really then dehydrated, wasn't he?
Yes.
And it just wasn't picked up?
No.
And that was 4.5 months?
Yes.
And three admissions in hospital. Okay.
The specialist then promised to write a report to support a second approach to the Health Complaints Commission.
And did you get that report?
He kept putting it off and putting it off. I phoned, I sent letters, and at the same time he wouldn't give up his own notes.
So you'd given him all of the information you'd accumulated?
Correct.
But he wouldn't provide you with the notes he'd made?
That's right.
So Anne complained to the medical board, who in turn rejected her complaint after the specialist handed them his notes. But she had another shock coming when finally she acquired them through Freedom of Information.
What did you discover?
The notes that he sent in were probably about 80% notes that I'd given him at each appointment.
So the notes he submitted to the medical board were largely notes that you'd given him?
Correct. Yes, they were my notes rather than his.
Anne even found an ECG report of a female patient mixed up amongst the documents.
So after 4 years, you've discovered your husband's GP wrongly administered the medication, defrauded Medicare, that the specialist substituted your notes for his to the medical board, and yet the Health Complaints Commission and the medical board say there's nothing wrong.
All of that's correct.
And how does that make you feel?
To use a pretty bad term, but I feel gutted.
Well, it's alarming and extraordinary.
But Robert Brokenshire also blames the government for allowing the Health Complaints Commission to malfunction for so long.
I mean, most people are still coming to us as MPs, or they're going to the General Ombudsman, or they're going to media to try and get some resolve.
What is it that would satisfy you?
If they would listen to the truth, investigate it with the intent of finding out what truly happened, and then make the changes so that it doesn't happen to anyone else again. That is what will satisfy me.
And the Health Complaints Commissioner says she rejects the findings of the independent review and will respond publicly in due course. Graham Archer with that report.